Can I ask you something kind of personal? Do you wear a pad every day? Not because of your period, but just in case? Just in case you pee on yourself? Do you think twice before you laugh too hard, before you sneeze, before you cough? Just because you know what's coming? Have you ever had to do this dance? Do you rush to the bathroom and sometimes not quite make it? Maybe you've gotten so used to that slight dampness that's, in your underwear that you just consider it normal now. Maybe you've started carrying an extra pair of underwear in your bag. Maybe you've noticed the smell that you hope nobody else notices, but you're not quite sure. If any of that sounds familiar, first I want you to know that you are not alone. Millions of women and men live with this every single day. They buy the pads, they plan their life around bathrooms, they quietly manage it, and they never say a word to anyone, not even their doctor. And most of them, they've never brought it up with their doctor because they're embarrassed. They've convinced themselves, like this is just part of getting older. And I'm here to tell you it is not. And you do not have to keep managing it, okay? You can actually fix it. And that's what I want to talk to you about today. Because this chair right here that I'm sitting on, it has changed things for so many people. And I think it can change things for you too. You're the one who's listening. So let's just talk about this openly because honestly, there's nothing embarrassing about this. And this is what I want to stress. There's nothing embarrassing about this. It's just biology. Okay. So we have pelvic floor muscles. These are a group of muscles that support your bladder. If you're female, it supports your uterus, your bowels. And like any other muscles in the body, they can get weak over time, right? So if you've had a pregnancy, after childbirth, hormonal changes, menopause, all of these things take a toll on the muscles. And when they're not working the way they should, you start to get symptoms. So you leak, urine leaks out when you laugh or you sneeze or you exercise, and that's called stress incontinence. Or that sudden overwhelming urge to go and you can't hold it. That's the urge incontinence, right? So a lot of women often have either one or both. Some women also deal with pelvic heaviness or discomfort or changes in their intimate life that they don't even connect to the pelvic floor, but often that's exactly what it is. So here's what I want you to hear. This is incredibly common. Over 1 in 3 women experience some form of urinary incontinence, but common doesn't mean you just accept it. Okay, this is the EMSELLA chair that I'm sitting on, and I am genuinely so excited that we have this in our clinic here at Dr. Cindy Care because it has been a game changer for so many of my patients. So let me tell you what it does. So EMSELLA uses what's called high-fem technology. So it's high intensity focused electromagnetic energy. And what that means in plain terms is that it sends energy through the seat of the chair into your pelvic floor muscles and it causes them to contract. Not just a little bit like what they would tell you to do with your Kegels after you have babies. We're talking about a super max contraction, deeper, stronger than anything you can do on your own, right? So that's why you need the help of the chair. So in one 28-minute session, your pelvic floor performs the equivalent of over 11,000 Kegel exercises. I know, unbelievable, right? Because I can't sit here on 1,000 Kegels. No way in hell. But that's the science behind it, and that's the result. That's why we're seeing the results we're seeing. And here's what I love telling patients: you sit on the chair just like me, fully clothed, nothing invasive, nothing is going in, not into your vagina, into your rectum. You just sit right here and you'll feel a pulsing, contracting sensation, right? It's very unique, unlike anything you've ever felt before, and it's not painful. Most of my patients just relax, they catch up. 28 minutes later, you're done. You walk out. No recovery time, no downtime at all. We do recommend that, you stay hydrated, but in all, we recommend 6 sessions of this. So 2 sessions every week for 3 weeks. The process actually looks like when you come in, this is what it looks like. First, we sit down together, we just talk. I want to understand what you're experiencing, how long it's been going on, what's affecting your daily life the most, because every woman is different, right? And I want to make sure that this is right for you. So EMSELLA is a good fit if it is a good fit, and for most of my patients it is. The only patients who would probably be excluded is if you have any metal. We'll get you started on a course of 6 sessions. So it's 2 sessions per week for 3 weeks. Each one is 28 minutes. By the second or the third session, women are already telling me that they're noticing something different. It's almost kind of like I can hold my pee longer. By session 6, I get to hear things like I sneezed yesterday and nothing happened. Can you picture that? Or I slept through the whole night. Or I went to spin class and I felt fine. So those are the moments, honestly, that, I do what I do. Results always continue to improve, for several weeks after you finish the treatment. This isn't on. We kind of get you on a session. It helps treat those pelvic floor muscles. They keep getting stronger. And many patients often come back for like a maintenance session a few times a year to keep those results going. I want to be really clear about who this is for, because I think a lot of women assume they're either too young or too old, or that their symptoms, aren't bad enough to seek help. So EMSELLA is a wonderful option if you've had children, if you're noticing changes in your bladder control, if you're going through or you have been through menopause and things have, just shifted. If you're active and your workouts are being affected, if you've tried Kegels but never really felt like they worked, if you're seeing a pelvic floor physical therapist, this works in conjunction, because most of us were never taught how to do Kegels correctly, right? So this is an added bonus. The women I've treated with EMSELLA, they span their 30s all the way into their 70s, and the results across the board have been really meaningful. Okay, so if you made it this far, thank you for letting me share this with you. If something I said today, felt familiar, please don't wait. Contact our office. The number is on the screen. I know it can feel awkward to bring this up even with a doctor, but I promise you, in my clinic, this is completely safe. It's a judgment-free zone. We talk about things like this every single day, and we genuinely want to get you the solutions. We love helping women feel like themselves again. This is why I'm here. The link to book a consultation is right below this video. You can also call us at 717-913-5349. Visit our website at drcindycare.com. If you have questions before you're ready to book, drop them in the comments. I'll answer, or someone from my team will. You deserve to be able to feel strong and comfortable in your body. And I would love, love, love to be part of making that happen for you. All right? I'll see you in the next video.